For today's webinar, we have Dr. Margaret Warner from the National Center for Health Statistics presenting the importance of data to the MDI community and stakeholders. Without further delay, here's Dr. Warner.
Good afternoon. I'm Margaret Warner from the National Center for Health Statistics, which is one of the Centers for Disease Control and Prevention. And today I'm going to talk with you about the importance of data to the medical legal death investigation community and its stakeholders. There's lots of information that medical examiner and coroners gather during the course of a medical legal death investigation. The information is gathered, of course, for the primary purpose of identification of the decedent and for determining the cause and manner of death. The information serves many purposes beyond that for the medical examiners and coroners, as well as for the many stakeholders who rely on the information for their work. In the talk today, I'm going to provide an overview of how the MDI community and its stakeholders use the data, provide some background on the types of data that are collected, and finally, a little bit about some activities to help modernize the mortality data infrastructure to help make it easier to use and share the data by both the medical examiner and coroners and the stakeholders. However, before I go into all those topics, I want to make sure that all those on the call who are not as familiar with the work of the medical examiner and coroners know about the types of data that are collected. When a death is reported to a medical examiner and coroner, there are a variety of sources of information used to decide whether to take the jurisdiction of the case, and then further information is gathered to determine the cause and manner of death, as well as other important information about the case. They consider the circumstances and the history of the death, including information about the death scene, witness statements, and some information about the person's history, such as their medical history, their prescription history, and some about the legal history. Some of that information is photographs. Some of it, as I mentioned, is medical history, prescription history, which may be in PDF form. So there's all different ways the data come in. Another part of the investigation may be an examination of the body. They may do either an external exam or an autopsy. Again, a lot of information is gathered during this part of the investigation. There may be X-rays, CT scans, or biopsies with, again, different formats for those information. There may be auxiliary tests from other offices or laboratories, such as toxicology labs. So the data may need to come into the data system via a different format and not directly entered or gathered from the people working in the offices themselves. There may be genetics and other types of lab results as well. So there's lots of information in lots of different formats. And it may depend on the cause of death, what types of tests are done during the course of the investigation. But all that information is used, again, to determine the cause and manner of death. And the most pertinent information is captured on the death certificate, which is required for every single death investigated by a medical examiner and coroner. And that's sent to the vital registrar. So that is an enduring information about the cause of death. More detailed information may be stored in case files or in a case management system, and those vary in the sophistication and nature of the storage, and we'll talk a little bit about that during the talk. So how is the data useful to the medical examiner and coroner offices? And that's where I want to start, because ultimately medical examiner and coroners are collecting the data for their own purposes, but many rely on the information for other purposes, a lot because the types of deaths they investigate, there's no hospital records for many sudden death, such as car crashes or other traumatic deaths. So the information collected in the medical examiner and coroner's office is very valuable to help prevent those deaths and understand the causes. So clearly the information is useful for determining an accurate and timely identification and cause and manner of death for death certification purposes. The data is used for mandatory and voluntary reporting and responding to requests from others like public health, safety, and the media. And oftentimes, even county executives or governors may be interested in the information. For instance, I know from work that CDC has done on disaster-related death that many medical examiner and coroners will receive a call from someone in either the governor's office directly or the emergency operations center to request information about deaths that may have occurred during a natural disaster. There are uses within offices as well for the data, for instance, enabling office management, including determining staffing and resource needs. For instance, to keep track of how many autopsies a particular forensic pathologist has performed, to make sure they're meeting standards of practice, used for formulating budget requests as well, and to ensure the consistency in investigation. For instance, what cases do you accept jurisdiction on? What scenes are visited? And all this looping back to budget requests, because the extent and types of deaths investigated will impact the budget. So being able to demonstrate with data to back it up, the need for an increase in budget or reasons that budget may be increasing, and just to let them know when you're making your budget requests that this is what you may be losing if a budget is not increased. So I want to move on to other stakeholders who use MDI data. It's used as an early warning system for impending public health emergencies and to monitor health and safety. And this is what I do as an epidemiologist at the National Center for Health Statistics. I work in the Office of Vital Statistics, and I use the information to help better understand the causes and circumstances of sudden death to help prevent the deaths. So it does have a lot of valuable purposes for public health and safety, and I'm going to share some of the data systems that use these data in a few minutes, elucidate the purposes. It's used for for identification and also to help identify potentially missing persons. It's used for emergency preparedness and management. As I mentioned, during disasters, it's always important to know the types of deaths that are occurring. It's used to inform policy and priority setting and to document the impact of interventions, and also for researches into rare as well as common causes of death. So I want to acknowledge, I've talked about stakeholders broadly, but I want to sort of drill down a little bit about who I mean by stakeholders. And this is really just a list of the many, many folks who rely on medical examiner and coroner data. Many of these folks have authorized by uses for the data and have data sharing agreements. Others, you may have limitations on what you can share with them, but I do want to mention that when I'm talking about stakeholders, I'm meaning folks who have valid reasons for needing the data, as well as the authority or agreements in place to receive that data. And many times that's in an anonymous form, so most public health is not interested necessarily in the knowing the name of the person or any information about the decedent other than basic demographic information, and often in the aggregate so that it's not personally identifiable information. So the vital registration, vital registrar obviously has an interest in medical legal death investigation for death certification purposes. The government, and for its many programs, including the federal, state, and local level governments, and I'll talk a little bit about the federal programs in a few minutes. There's other types of policymakers who are interested in the data. Organ and tissue procurement requires immediate information on the death in order to identify potential donors. Of course, law enforcement and prosecutors rely on the information. Public safety as well, public health, I've mentioned CDC where I'm from, departments of health within the state or county, as well as academics. Hospitals and trauma centers rely on information from medical examiners and coroners, and sometimes forensic pathologists sit in trauma center review committees talking about preventable deaths. There's fatality review committees. Many of you may know about infant death reviews, as well as child and also newer drug overdose. There's also elderly fatality reviews and many other types of reviews. Researchers, both academic and otherwise, are in need of information about both causes, as I mentioned. The media is, I know from about both individual cases, but also information in aggregate, like how many drug overdose deaths there were in the particular jurisdiction. There's advocates often turn to the medical examiner and coroner community to provide information about specific causes. And of course, families definitely rely on the medical examiner and coroners to provide information. So I'm going to talk about federal agencies as stakeholders only because I wanted to highlight some of the systems that you may recognize that are national in nature. The data are critical to the federal government for monitoring public health and safety and informing policy generation, rulemaking, and evaluating science and technology investments. And I want to sort of emphasize that these data are used to make sure that interventions that to help prevent death are having an impact. And I want to highlight over to the right hand side, there was a report in 2016 from the White House Office of Science and Technology Policy that documented all the uses of the medical examiner and coroner data. And in fact, over 40 agencies use the information. So this slide lists many of those agencies, including from the Department of Health and Human Services, the Centers for Disease Control, the Consumer Product Safety Commission, the Food and Drug Administration, the Substance Abuse and Mental Health Administration, and Emergency Preparedness, as I already mentioned, just to name some of the agencies within HHS. The Department of Justice, including the Drug Enforcement Administration and the Bureau of the Prisons, and the National Institute of Justice also has data systems as well as a lot of programs to support medical examiner and coroners. The Department of Transportation is interested in all kinds of deaths that may occur during persons moving about the world. National Highway Traffic Safety Administration keeps track of car crashes. The Federal Aviation Administration does work with aviation crashes, and many of you, if you've had an aviation crash, may have had some kind of reach out from the FAA about the pilot. The Department of Labor keeps track of information about occupational injuries. As a result of all this background into the uses of medical examiner and coroner information for the federal government, there was developed a interagency medical legal death investigation working group from the Department of Justice, Office of Justice Programs, as well as HHS. And that group has been meeting for many years now and discusses issues related to medical legal death investigation and helps to coordinate activities. And I encourage you to look at the website to help get a better sense of the types of programs that the federal government has with medical examiner and coroners, and also some resources that you may find helpful if you work in one of those offices. So next I'm going to show a sample of some of the federal data systems, again, to give you a sense of the types of information collected. The first system I'm going to be talking about today is the vital statistics mortality data. And as I mentioned, this is the office where I actually work in. And vital statistics mortality data is based on information from death certificates filed in the 50 states and the territories, as well as DC. After you certify the death, the information on the death certificates is compiled into an electronic data system that within a state, and the state, through a cooperative agreement, shares that with the National Center for Health Statistics, who aggregate the data, and the data is anonymized for that sharing purpose. It's used to monitor causes of death in this country, including understanding the leading causes of death. You may have seen some information from death certificates on excess deaths during the COVID-19 crisis, for instance. It's used to monitor life expectancy and for many other purposes, such as cancer research and other types of research into leading causes of death. There are many programs that actually rely on vital statistics data as part of their work, and I'll share some of that with you during this talk. So the next data system I want to talk about is the sudden unexpected infant death and registry and the sudden death in the young case registry. And these systems help to standardize the process of investigation, including developing the SUDI investigation guidelines, which many of you use during your work. And this helps to create more uniform data to more accurately monitor SUID and SDY rates. So again, it helps to create a system where the data can be compiled across jurisdictions, and all that uniformity helps make it so that the data, you're comparing similar data items. So in common way of thinking that is comparing apples to apples instead of apples to oranges. And that's a lot of what that SUDI investigation guidelines is helping to create more uniform data. The data are used to help understand potential risk factors as well as to prevent future deaths. So on the SUDI website, there are some actual examples of how the data is put into action. I don't have time to go into that today, but I encourage you to look at that website. And the next system I'm going to be talking about is the National Violent Death Reporting System and the State Unintentional Drug Overdose Reporting System. Both of these are for non-natural deaths. So the National Violent Death Reporting System actually compiles information from state-based violent death reporting systems, which is how you may know them. And the information is gathered from law enforcement, death certificates, and medical examiners on violent deaths, including homicides and suicides and undetermined intent deaths, with the information again being compiled to gather more detailed information that's available on the death certificates about those deaths. NVDRS is now in every state in the country. So yeah, it's a big move there from being in just a few states a couple of years ago. So the State Unintentional Drug Overdose Reporting System is again a system that uses a similar model to NVDRS, where information is compiled at the state from death certificates, medical examiner, and coroner results, but with a focus on the toxicology results. And then the information from the state is compiled on a national system, and that system is coming into most states now. So NVDRS and suitors also have examples of how those data are put into action on their website. I wanted to mention a few systems from the FDA, including the MedWatch and Vaccine Adverse Event Reporting System. The importance of these systems is obvious at this time, and VAERS is a passive reporting system, meaning that it relies on individuals to send in their reports of their experiences. And anyone can report to these systems, and medical examiner and coroners are strongly encouraged to use the systems to report potential cases for follow-up. So again, a passive reporting system, but definitely encouraging medical examiner and coroners to provide information on these adverse events or potential adverse events. So the national NAMIS, or the National Missing and Unidentified Persons System, is a system from the Department of Justice that is designed to help resolve unresolved cases, and also to help resolve cases that identified decedents for medical examiner and coroners to resolve those cases. I'm assuming most of you know about that system and use it to help in your casework. The next system I'm going to mention, and the final system, is the CPSC's Medical Examiner and Coroner Alert Project, or MECAP. The CPSC's mission is to protect the public against unreasonable risk of injuries and deaths associated with consumer products. And the first step for the Consumer Product Safety Commission is to find potentially hazardous products. There's so many consumer products out there, and they want to find those hazardous products as quickly as possible and to identify them before they cause more harm. They use a variety of methods to find these products, such as hospital emergency department reporting systems, death certificates, news reports, fire departments reports. But the reports from medical examiner and coroners are obviously of very great importance to the CPSC, because death is, a very bad health outcome. And so they want to make sure that they are alerted of any death that you in your office may believe is related to a consumer product. And I encourage you to use that reporting system. So I want to talk a little bit about data to action. And I mentioned that all those federal data systems do have information about how they're used to prevent deaths, and in the case of NAMUS, how they're able to bring closure to cases. So I encourage you to look at those to see some of the success stories, that data that is collected. But I want to bring it back to those of you who work in offices of medical examiner and coroners. And I know that there's a lot of ideas and hypotheses that are generated during the course of your work. Some of those are taken to the next step, to have studies to take place in your offices, and you may work on some of those studies. And data obviously plays a major role in that work. Science is a data-driven activity, and all the hunches in the world without data to back them up, are just anecdotal. So, and I want to sort of emphasize that sometimes it's relatively simple statistics from data that can provide a powerful message and back up your observations and back up what you see in the course of your work. So I have a very cogent example from 1979 describing just that, which I'd like to share with you next. So over to the right, you'll see Susan Baker. And back in the mid-70s, Susan Baker was working as an autopsy tech in the Office of the Chief Medical Examiner in Maryland. And you may recognize her name, since the National Association of Medical Examiners has the Public Health Award in her honor. And back in the 1970s, car seats for infants were only beginning to be used, and seat belts were shown to be impactful, but car seats were newer to the picture. And based on what she was seeing in the autopsy room, she believed that infants had a higher death rate in car crashes than older children, but she didn't have the data to show it. She did work with the vital statistics data to drill down to get more detail on car crashes, and looked at data by single year of age, which wasn't done at the time. At the time, in 1979, all data were shown for ages 0 to 4 altogether, and I couldn't tease out, or not on standard data tables, you couldn't see occupant-related deaths. And once she had the data, she was able to drill down and look at the rates of death by more detailed age groups. So the graph on the left are the results of her analysis, which she published in a paper. And the first graph shows that the occupant death rates by single year of age. And you can see that for those less than 1 year of age, the rate of death is much higher, with decreasing rates until the age of 10. The next graph shows age in months, and again shows different patterns by months of age. And I have her quote from her reflection she had on this experience. And she writes that once she had the data tape, it took me about 10 minutes to discover that my hunch had been correct. And she says it still amazes her that the especially high rates of infants were not recognized until the paper were published. So there was no way to back up that what she saw in her as her hunch using data. So she believes that in the following decade, the information would be used, or says that the information was used by many states and proponents fighting to require that children be protected in cars. And now we know what's happened with children in car seats. Another example I want to show of relatively simple statistics providing examples of providing backup of information that you may know in your work is drug overdose death statistics. And again, I'm going to start in 1979 and go to the provisional data from 2021. And this graph, again, begins back in 1979 when Susan Baker was working as an autopsy tech in the OCME. And you can see that from 1979 to 2019, the motor vehicle traffic crash death rate decreased. And much of the decrease was supported by data, either using statistics like Susan Baker did, but also other more subtle statistics with all kinds, and all those types of data to look at car crashes in all different ways led to a variety of different interventions, either the cars, such as including brake lights and crumple zones, changes to the roadway design, and changes in behavior like campaigns against drunk driving. In the meantime, overdose death rates were increasing. And I want to focus on the early part of this graph. This is drug overdose death rates from 1979 to 2019. And looking at the upper left hand, I've blown up that area from 1979 to 1999 just to show that the rates of death were increasing for drug overdose in that early period quite a lot. And medical examiners and coroners were early on saying during this period that the number of deaths was increasing, but the data were not as available then as they are now to show that increase in those individual offices. And in the early part of my career, I did a lot of work to say that yes, these were real increases and it wasn't some artifact of the vital statistics data, but it was in fact backed up by data from offices of medical examiner and coroners. So the mortality data is getting more timely, and I thank you for all your work. If you work in an office of the medical examiner and coroner, to get that information to us in a more timely way, so that we're able to show provisional data from vital statistics. Before it took a long time to collate all that information, and drug overdose deaths in particular take a long time to investigate and diagnose, but without that early indication, prevention efforts can be hampered. So I wanted to share with you information from provisional drug overdose death data from vital statistics showing that in the period, 12-month period ending March 2021, so from March 2021 to all the previous years, the number of reported drug overdose is about 96,779. Now, we don't have all the data in, and we're predicting the number of deaths to be closer to 99,000 once all those deaths certificates are received. So that's a 30% change, or 30.8% change from the previous 12-month period. So clearly quite a big increase in drug overdose deaths, which you may have experienced if you work in an office of the medical examiner. So those are relatively simple statistics from vital statistics data. I wanted to highlight the data that the chief medical examiner in Connecticut puts out on his website showing 2020 data by all different types of drug overdose. So those relatively simple data from offices of medical examiner are very impactful for understanding and the nature of the drug overdose crisis in this country. And so don't feel that the data needs to be that sophisticated, but clearly data is important for understanding the types of deaths that are occurring. So let's talk about what we mean by data. And I've talked a lot about data in this abstract, but I want to get down to the nitty-gritty of data and what data to gather, store, and what types of data to share. And there are many reports recognizing the importance of the medical legal death investigation, and I've highlighted just a few here. But many of these have recommendations, which I'll share with you in the next couple of slides. So there was a White House Office of Science and Technology report, which I talked about earlier, and they talked about the need for working on establishing common elements that are critical in forming policy generation, rulemaking, and monitoring public health and safety, and to work with state and local and tribal entities to help establish what those pieces of information might be. And I want to also acknowledge the work of Randy Hanslick from 1995. Randy, as you know, or may not know, Randy Hanslick was very interested in data and showing the importance of data for both medical examiner and coroners. He himself was a medical examiner and worked in 1996 to create a medical examiner and coroner death investigation data set document, which sort of outlines the types of data that medical examiner and coroners collect. And it's an older document, but it's a great document, and there's very basic information about deaths, such as all the information that goes on the death certificate, which is clearly the minimum type of information needed to be collected, but also includes in many more pieces of information. So fast forwarding to a couple of years ago, the National Institute of Science and Technology Organization of Scientific Area Committees for Forensic Sciences started to undertake some work to look at data that's commonly collected within offices of medical examiner and coroners. And the focus of that work was to think about what are the types of information that are key to collect in order to perform both an investigation as well as information that others may need. There was the idea of a common core set of data elements that are used to ID, for identification, demographics, cause and manner of death, time and location of death, and the medical and social history, as well as toxicology. Most investigations include information about these. And then there'd be cause-specific data elements that would be relevant for certain causes, but not for every single cause of death. So let's move into a little bit about the medical legal death investigation data modernization effort, and in acknowledging just how much data is out there that's collected on a medical exam during an investigation, as I alluded to in the early part of this talk. And we know, or have learned, that medical examiner and coroners get a lot of requests for their data from both media, policymakers, public health and medical research, and law enforcement and public safety, just to name a few. So the idea of data modernization is to make it easier for medical examiner and coroners to provide more specific and up-to-date mortality information in a coordinated and consistent and secure way. And I sort of emphasize the secure because some of these data are sensitive and want to make sure that the data is shared in a way that is modern, secure, electronic transmission. It's important to go across jurisdictional boundaries for reasons such as with disaster-related deaths, but we want to be able to compare apples to apples and not have uniform ways the data are presented. And the ability to get data for data providers to get more out of the data they collect, I think that goes without saying, and also without disruption to the workflow. So in our modernization effort at the National Vital Statistics System that I'm a part of, the idea is there's a community of practice to design, test, and build standards-based approaches with open APIs, enhance existing electronic mortality data systems. And it includes participation by MDI. So again, standards-based approaches. So there are data standards for the data as well as for transporting the data. And API approaches are ways that technology is used to transport data in a more standardized way with all those security protocols built in. So the NVSS, the National Vital Statistics System Data Modernization Initiative, is part of a larger data modernization initiative within the Centers for Disease Control. And again, medical examiner and coroners play a role in the vital statistics data ecosystem, with them providing information to vital registrars on sudden deaths. So this is just the medical legal death investigation diagram outlined, showing data collected during the course of the investigation being sent to the case management system, or compiled in the case management system, going to the electronic death registration system, and also to NCHS. And then up on the top is all these different data systems that are receiving information from any one of these different sources. I want to acknowledge that, of course, not all medical examiner and coroners have electronic records, but most of the larger and medium-sized jurisdictions are either partially or totally computerized, and this is a challenge and something that data modernization will need to tackle. So an example of a medical legal death investigation to electronic death registration I wanted to highlight. So the medical death investigation case management system going directly to an EDRS in an interoperable way. We're working with the NVSS modernization community of practice and partnering with vital registrations jurisdictions to design, build, and test interoperable systems. And they're testing using the vital records death reporting data standard HL7 FHIR, and also designing standard APIs for interoperability. And this is just an example highlighting, or going back to that diagram I showed you before, highlighting the workflow that's being looked at for interoperability. And again, there are data standards for death certificate reporting, which can be adopted for medical examiner and coroners importing or working with vital records. And the data models for HL7 FHIR are quite elaborate, and I wanted to just make sure that you knew it's not a simple model. So this is an example of interoperability and certification within an MDI case management system. And the idea here is that the death is certified within the case management system. In other words, log out of one system and log into another to certify the death, but the death is certified right within the case management system. And then the information is sent directly to the vital records system. And there's a lot of background work that's going on behind the scenes here to make sure that the right case is matched with the vital records data system, and that's what an API is working on, to make sure that the data are, the correct decedent is matched with the correct decedent in the vital records system. But again, the idea is to save time and make it easier to certify deaths. The next example I'm going to show is getting the most out of your data through active analysis and visualization. The data are sent to a dashboard that is able to show data in a more visual way and make analysis easier and on the fly. So this dashboard shows the types of cases in one system, and I'm happy to share some of those examples if you're interested in seeing the data in that way. So the next example I wanted to talk about is the toxicology results going to an MDI case management system. And again, this is part of that NVSS modernization initiative, where the information, and this one is much more in its infancy, looking at how toxicology information can be sent in a direct way to the medical examiner coroner case management system, and looking at data standards to make that so that the information can be then sent not just to a case management system, but potentially to some of these other public health and public safety systems. And all that is critical to think about, the idea that once data standards and interoperability is achieved in a standards-based way with one system, those standards-based approaches can be used with other systems. So it's not a one-off case of interoperability, but could be reused and repurposed with other data systems. So again, this is obviously toxicology to case management systems obviously is important for drug overdose deaths, which are increasing, in order to get that data in a more timely way. So a bottom line for the data modernization is we need to strengthen every link in the chain, and medical examiner and coroners, toxicologists, as well as other forensic disciplines play a role in that link between the data systems to get medical examiner and coroners the information they need in a more timely way, as well as to get information to the public health and safety partners in a more timely way. So I thank you very much, and I look forward to your questions.
All right. Thank you, Dr. Warner, for that fantastic and informative presentation. Let's go ahead and get right into some questions from the audience. First one I have here, there is an audience member who is an anthropologist in an ME office, and they are asking, is there any effort to standardize the ways in which race and ethnicity data are collected? Her research shows high error, which may affect disparities research.
Yeah, that's a great question. I would say that, yes, there is an effort to standardize that information. I'll talk first about from a national level and on death certificates in particular. There was an OMB, Office of Management and Budget directive many years ago to increase the classification and describes how race and ethnicity should be reported. I think those very detailed classification schema could really help get at some of the detail that could be gotten from a medical examiner and coroner's office. With that said, many of the data systems within those offices do not provide detailed into the race and ethnicity of the individual. And I'd love to, for the person asking the question, to shoot me an email and we can talk about that, because I think that certainly is an area that we could work on when we're talking about data standards within medical examiner and coroner offices in particular. As I mentioned, we were working with the old report that Randy Hanslick had developed, and then moving on to work on the reports from the Organization of Scientific Advisory Committees, where this was seen as something to consider. But certainly, medical examiner and coroner's office has a lot of information on that, on the decedents' race and ethnicity. Unfortunately, not self-described, but from both the next of kin as well as from observation.
In the same kind of general vein, I got a question here. Will there be data standards for MDI, and who decides what those will be?
So yeah, that's a great question. We are hoping to start developing data standards, and there's a lot of work going on in this area. I think I just mentioned the Organization of Scientific Advisory Committees, Forensic Science, Medical Legal Death Investigation Subcommittee, working on looking at data standards and starting again with sort of deciding on what standards bodies to use once the data elements are developed that need to be standardized. So there's also a project with your own group, the Forensic Technology Center of Excellence, to look at the types of data that needs to be standardized, as well as thinking about the types of data standards to use. In other words, what would be the standards development organization to go with? I will mention, I think I mentioned during the talk that there's some data standards being developed from HL7, which is a health-related data standards body that the vital registrars are using for their work. So that's probably a direction that the standards will move towards.
Awesome, thank you. And I have probably a quick answer question here that might help a lot of people. We have a few people in the chat asking what API stands for.
Sorry, I was running out of time, so I did gloss over an API, and it's a very good question. An API is an application programming interface, I believe it's interface, but it's a way that APIs are used for when data systems are talking to each other, and I'm gonna sort of fumble around with this answer a little bit, but APIs are used anytime data is, or in a very, not even that modern, but in the last 10 years, APIs are used to help transport information between systems. So if you think about when you get you're looking at your bank account app, and you're fetching information about what your balance is on your bank account in your app, that's an API, is fetching that information between the two systems. So it's a way to securely pass information back and forth. And that is my very epidemiologic understanding of what an API is. But I encourage you to look up API in the web. In this particular application, the API for the going between the case management system and the EDRS, it is taking information from the medical examiner, knowing the information about the decedent, like the age, sex, and then other information that they may know, the name, address, that kind of thing that they'll know about the decedent. And then the API will search through the EDRS information to try to find if the funeral director has submitted demographic information about the decedent. It will present some information, potential matches, to the medical examiner, who then will be able to check off which decedent would be the likely match. So that's what the API is doing in this case, that application programming interface.
Awesome, thank you. I think that'll be definitely help with framing things a little bit more for the audience. Next question I have here is related to funding sources. So I don't know if you might be able to speak to this directly or more so just from what you've heard, but do you know of, the question is, what funding sources are available to upgrade CME electronic case management systems? With so many different systems being used, how do we standardize the process? And again, I know that's not kind of in your purview, but I don't know if maybe you might have heard some things adjacent or in passing that could shed some light on that.
Yeah. I am reluctant to, I mean, I think that there is, I have heard that there is in potentially some sources of grants that states may get for different purposes may be able to be applied um, to use to upgrade or do various activities with a case management system. I've certainly heard of that happening in some states, but there's no direct funding for case management systems at this time. I think as we move towards interoperability, sort of demonstrating the value of the system and demonstrating, you know, that the information could be retrieved, fetched and retrieved and sent to others more quickly will help the case to get the new case management systems. And I would add that as part of the CDC modernization activities, we're not developing a case management system, but we are developing open source code that can be used with case management systems. So that may be helpful as well.
That was actually going to be another question, which I know you did cover in your presentation, that the CDC wasn't so much developing its own case management system as much as it was developing, like you said, the open source code and different components and standards to utilize in that same direction. I guess one of the things that I'd like to bring up from that question is that a current privately developed MDI systems vary wildly in efficiency and quality and don't communicate well, if at all, with other systems. So I don't know if you wanted to go into any detail or anything else that you might want to cover related to the efforts that the CDC are taking to kind of break through those issues of the siloed off different case management systems and things not meshing with each other.
Yeah. So yes, there are definitely a lot of different case management systems out there. And in fact, your group, the Forensic Technology Center of Excellence, is currently working on a landscape analysis of the different systems to sort of highlight components of case management systems that are available and a lot of different information about them. So that should be coming out. I'm not sure, maybe in the spring, but that should help sort of describe the different systems. And certainly there's a lot of different prices of those systems as well. In terms of sharing data, this is the idea behind data standards. So the data don't have to be stored in exactly the same way. Like if one system has M, or for sex, one system has M and F, and one system has 1 and 2, or perhaps more options as well. I don't mean to be limiting in that way, but the data standards, the information can be sent if it can be exported into some kind of either a spreadsheet or some kind of system can be exported. It can be fed into a way to translate the information into a common set of common variables, so that the information can be aggregated across different offices. So in other words, the date and time and place and a lot of information about the decedent, and that information can be translated or mapped into common sort of terminologies, and then can be grouped together and shared in that way. So that is coming, and I'm happy to We do have what's called, in some of our work we're doing on data modernization for creating these standards, we do have a mapper, so it can take information from one system and translate it into this standard Firebase data, and then the data can be compiled. So happy to work with anyone who wants to try out that mapper and see how it works with their system. But that is
Awesome.
definitely a problem or a challenge.
So I think we have time for maybe one more question. So I wanted to end with this one just to kind of bring it back full circle. You had mentioned there was a federal interagency work group. Are there any medical examiners or coroners on that group?
Yeah, so we have a couple of death investigators, and there's just, I think, 3 people who are have worked in the medical examiner and coroner field. There's many people like myself who are stakeholders and know quite a bit about the activities, but aren't actually medical examiner and coroners. In the interagency work group, we have invited National Association of Medical Examiners, the International Association of Coroner and Medical Examiners, as well as ABMDI, the American Board of Death Investigators, to provide input and share some of their challenges and ideas with the group. So we do are interested in input from the community. We also do have that resource page, so there's some transparency in the discussions that have transpired during the interagency work group.
Awesome. Well, thank you. I think that will conclude our time today. So we'll go ahead and start closing things out, and start by saying thank you to our presenter for taking the time out of her day to present the material for today's webinar. So Dr. Warner, thank you again for taking that time and providing such a wonderful presentation.
Well, thank you so much. It's been a pleasure.
Before you leave today's webinar, we ask if you could participate in a short 5-minute survey. You will see a checkbox icon directly above the chat. Simply click that button to be linked to the audience feedback survey for today's event. Your feedback about our webinars is critical information that helps us improve and continue to provide you the best webinar experience possible. If you could please take those few moments to complete the survey, we would greatly appreciate it. Lastly, across the top of the live stream window are links to all our social media profiles, including Twitter, LinkedIn, and Facebook, a link to our website at forensiccoe.org, and a link to listen to episodes of the FTCOE's podcast, Just Science. There's also a link to sign up for the FTCOE newsletter so you can stay up to date with everything that FTCOE is doing in support of the forensic community. Thank you again for attending, and we hope everyone has a great day.